Recurring low numbers of new COVID-19 infections, a decline in vaccination uptake, and testing for the virus are all challenges being faced by the Ministry of Health weeks after a decision was made to remove all the COVID-19 restrictions which stood for the past 2 years. According to statistics from the Ministry of Health, just one person was confirmed COVID-19 positive on Monday, while 2 persons were being treated in the COVID-19 intensive care unit. The isolation numbers have also been on a downward trajectory. Shadow Health Minister Dr. Cummings, during a telephone conversation with Nightly News on Tuesday, opined that the pandemic is far from over, and at a time when the country is enjoying low active caseloads and infrequent deaths, it should not down tools. Instead, she advanced this time should be targeted towards strengthening policies in relation to the pandemic to ensure that active surveillance and contact tracing are maintained.
Let's try to narrow the gap between our hinterland and the coastland, and we must continue with our treaties, I call it, the contact tracing, the testing. We can't, decrease testing now. Continue to treat our patients in ICU and elsewhere.
She made reference to the United States, China, and parts of Europe where the Omicron subvariant is wreaking havoc, while noting that at this juncture, frontline workers along with persons living with comorbidities should be able to obtain free self-testing kits in addition to the PCR and antigen tests available. COVID-19 self-testing kits are being sold in Guyana at various pharmacies. The former health minister suggested that in areas where there is low vaccination coverage, the COVID curb operation should be activated to curtail some social activities. She reminded that while the attitude of the populace has changed towards vaccinations, owing to perceptions that enough of the population has become immune to the virus, the immunity provided by the jabs wanes with time.
It just wanes after about 6 months. And so we have to be very careful if you're going to, open up to these crowded spaces, and you don't know who has been symptomatic and who's not, and so you have to be very careful. The testing, of course, I agree with you. People won't come to testing. Well, why do I need to test? But of course, we can probably make a statement of those who are vulnerable, the immunocompromised, those who are, at-risk population. So to go for testing periodically, they can work with some system at the health center or the physician.
Several weeks ago, Health Minister Dr. Frank Anthony defended the country's reopening against criticism from the opposition. Timeka Rodney reporting for the HGP Nightly News.